Perfect. Go right ahead.
Thanks so much, Kristen. Welcome, everybody. It's great to see you all. It's great to see our wonderful panelists and folks from HLT 300 and other folks who are here today. So thanks for attending this Major to Career panel very generously hosted by the Center for Career and Experiential Education. All shout out to Kristen. My name's Steve Cohen. Most of you know me. I'm an associate professor here at URI in the Department of Public Health. As Kristen said, the panel will be recorded. And I just want to start briefly by asking each panelist to introduce yourself and a pronoun if you'd like, as well, and your current position title.
I can
Well,
go
yeah,
first.
thanks, Anna.
Of course. Hi, everybody. My name is Anna Talamas. I am an analytics manager at 32BJ Benefit Fund, and my pronouns are she, hers.
So should we go to next to let's go to Sarah. You're next on my list.
Good morning,
Good
everyone.
morning. There's two of us.
Oh,
I'm sorry.
That's all
Sorry,
right.
yeah, you're Sarah. Sarah Shaw. Yeah.
All righty. Sorry about that. Good morning, Sarah Shaw. I'm the Director of Food Programs at the Johnny Cake Center of Westerly.
Thanks so much. Sorry, other Sarah. Can you introduce yourself now?
no problem. Good morning, everyone. My name is Sarah Ogundari, and I'm currently working as a program evaluator at Rhode Island Department of Health.
Excellent.
And my pronouns are she, hers.
Thank you. And last but not least, Tiffany.
Thank you, Steve. Hi, everybody. I'm Tiffany Jimenez. I'm a licensed clinical social worker, and currently I co-founded Access Psychotherapy. So I'm co-founder and therapist there.
So thank you all so much. We'll just jump right into the questions now. This is also a great learning opportunity for me because I know Anna very well from many years at URI and one of our absolute rock star students. And I'm also very so I'm excited to see her and I'm excited to hear more from the other Sarahs and Tiffany. And also, if the like Kristen said, anyone that's joining, please feel free to ask any questions as well. So we do have a few questions to begin with. So love to start by telling us about your career journey since you graduated from URI. What position did you start with, and how did you enter the role that you have now? And um, I don't know if anyone you want to start first.
I
Um,
can start.
oh, thanks.
No problem. So I graduated from URI in 2016. I majored in global and environmental health studies and English. Um, And during my first year post grad, I explored the opportunity of completing an English teaching assistantship abroad, and I applied for opportunities at the Rhode Island Department of Health and other state agencies, trying to look for an open door to start my career. Um, and I took a civil service exam. I don't know if any of you have heard of those, but some state jobs require a short exam before you can be considered for employment. So I decided to take a risk and take a civil service exam for an eligibility technician position with the Department of Human Services, and that was in 2017. And then I worked there for a little bit over a year before moving to Northern California. And I moved back to Rhode Island during the pandemic to go back to school for public health to get my MPH. And then after my first semester working towards my MPH, I started working at Department of Health on the COVID unit. So that was quite a bit of a journey. So I took a four year gap between graduating from URI and then going back to school. Um, and then after about a year and a half of working on the COVID unit, the opportunity to work on the drug overdose prevention team at the Rhode Island Department of Health opened up, and I took that opportunity.
Thanks so much, Sarah. Um, Maybe we'll stick with this theme of Sarah's, and other Sarah can go next.
Very well. My career path is a little less exciting. I graduated back in 2015. with a degree in health studies with a focus in health promotion. I think I was one of the first couple of classes that got to graduate under that degree program, which was really exciting. I'm at the same company that I started with when I graduated. So when I started, I was a part-time manager um, for the Johnny Cake Center, running their food programs, and it kind of just evolved naturally over the years. My position continued to grow, so the title kind of changed with it. I took on our garden and a few other programs that were developed under me. So the title of manager just didn't seem to fit anymore, and I, was able to promote myself a little bit up to that director position. This fiscal year, we're going to hire a manager under me. I've been working solely with volunteers and a part-time assistant manager, which has been very challenging. So we're excited to add that position to support my role. And then I can kind of venture off and do more director like duties, more things like this, sitting on panels and being a bigger part of the community. So my quick journey.
Thanks so much for sharing that, Sarah. That's awesome. Shall we go next to Tiffany?
Sure. So, like Sarah, I also graduated with a health promotions focus in 2015. So, hey, and let's see. So I started off, I think, working in like reviewing my resume, and I'm realizing that it's a little bit pieces of just randomness over the years, but there's definitely a theme to it, and I'll get to that in a minute. But so I graduated from URI in 2015, and I think I started off as an office manager at PACE organization, which is like a healthcare day center facility for senior citizens. I worked there for a little bit until I was trying to figure out sort of what else I could be doing. And I wasn't really sure what direction I wanted to go in. And so just on a whim, I applied to be a flight attendant. And it worked out nicely. It's one of the best jobs I've ever had. It was super duper random. And I was not a comfortable flyer before that, but there was just something appealing about challenging myself and seeing like, what are the chances that they'll reach back out to me? And so anyway, the chances were that they did. And so I was a flight attendant for 6 years until around 2020, where things really kind of changed the job, and which was okay, because I was already sort of wondering like, what else could I do? Like the job was great, and I had traveled, and it did a lot of good things for me. It promoted different kinds of growth for me in ways that could be enriching to like a young adult woman. And anyway, by that time, I think by 2021, I had sort of figured it out. And I thought, you know what? I think I'll go back to school. It's a great opportunity. I've got nothing but time on my hands. Why don't I jump into it? And so I jumped into a master's of social work program at Rick. And I started off part-time, and I went there for, let me see, I don't know, every 2 to 3 years. I finished up last year, and I loved it. It was the best choice I've ever made for myself. I would choose it again 1,000 times. I'm really glad that I took the time and waited to figure out what I really want to go to graduate school for. It's my passion. I know I'm in the right place, which is great. And so now it afforded me the opportunity to start up a private practice. And so a partner, Jill Pedersen, and myself sort of run this group practice where we teach other interns and other upcoming and passionate therapists how to be great therapists. And so that's where I'm at now, and that's where I intend to stay. So I think I've found my forever home as far as careers go. And that's my story.
That's amazing. I'll just make a quick comment. Not everyone has a linear path to where they want. So if you're not, you try different things, and circumstances change. That's an incredible story, Tiffany. And thank you for sharing that. I look forward to hearing more as well. Thank you. And last but certainly not least, Anna. Anna might be frozen. Oh, there she is. Okay. You're muted, Anna.
Sorry about that. My Wi-Fi was being a little spotty. Um, so happy to give a little bit of a update on kind of my journey from URI to now. So I graduated from the University of Rhode Island in 2018, and actually I went straight into doing my master's. So I went and did my master's in public health at New York University, and I specifically focused in on epidemiology. And while I was at NYU, I did research and kind of also got exposed to healthcare claims data through a club there. And that's kind of when I decided that that was something that I was really passionate about and kind of leveraging healthcare claims data to help better understand population health. So I graduated actually from my master's in 2020, which was a really interesting time because, you're watching the pandemic unfold, which are things that you've only read about in textbooks or modeled out in classes. So it was really interesting to watch that all play out. And then I got my first job at a company called Mathematica, where I did policy related research related to Medicare and Medicaid enrollees. And then I found the opportunity in my current role, which is an analyst at 32BJ Benefit Fund. So 32BJ Benefit Fund is the benefit fund for the 32BJ Union. So we serve over 200,000 covered lives. And my team specifically is in the health fund where we manage the healthcare benefit. So we actually manage and assume all risk on our healthcare benefits. So we work with our claims data every single day, which is part of what really drew me to the role. And I've been here for the last 3.5 years about, and I really enjoy working with this data and working with a population where I know that I'm making a tangible impact, because I think at the core of what I always wanted to do was to make an impact on population health, and I really feel that impact here in my current role. So yeah, that's a little bit about where I'm at.
Thank you so much, Anna. It's fascinating to hear I know your journey well, and it's just fascinating to hear how you got to where you are as well. And that so thank you so much for sharing all that. And I can tell already these four people are going to be incredible examples of different paths and different ways to get to meaningful careers, impactful careers. So Kristen, can we extend this to like 12:30 or 1:30 this afternoon? Just go 4 or 5 hours. That'd be great because there's so much there. So thanks so much. So now we have a couple of kind of general questions just to get the discussion moving. But if anybody on that's either panelists themselves or any of the students or anybody else that's joining has any questions, again, just please reach out either on the text or raise your hand, and we'll look at those questions answered. But a lot of you guys touched on this, but we kind of want to know a little bit more about how did you figure out what career path you wanted to pursue, and what were there any particular internships, courses, other experiences that you had that were really instrumental to making, to kind of like figuring out, the careers you wanted to like how you wanted to get there, whether they're positive or negative. I don't know if anyone has it.
I can go first.
Yeah, please. Yeah.
So I actually I knew I wanted to kind of go and do a master's, but I wasn't sure what concentration I wanted to get my master's in. And actually, it was Dr. Cohen's class in epidemiology that really solidified the fact that I wanted to get my master's in epidemiology because I saw it as such a powerful tool to kind of be able to have a hand in data because that's really what drives all the decisions that are being made. Um, and even now, even though I'm not using the same like rigorous epidemiological methods that I learned in grad school on a day-to-day basis, I think a lot of understanding how to look at data, understanding how to best leverage data, that's what I do every day. And that's kind of what drives also the organization. And so I think it was a really instrumental class in making sure that like I got to where I was and really helped me narrow down what I wanted to do. So yeah.
It was a pleasure, an honor to work with you, Anna. So, thank you. Anyone else? either of the Sarahs or Tiffany?
Yeah, I think actually just the variation in what the four of us bring to this panel goes to show like how open-ended this degree like this degree path can be. For me personally, when I was graduating, that was very intimidating. I remember those first couple of months post-graduation going, oh my goodness, why didn't I get into nursing? Something with a finite, outcome. And I think Tiffany, your example specifically is wonderful, where you had this um, this adventure where you got to be a flight attendant. Like it really shows that we get this degree and it's a wonderful thing and we really can make what we want with it. I stumbled across my position on Indeed, just scrolling and scrolling and scrolling. And when I read the description of the position, it really kind of fell in line with the things that were most important to me personally. I got to help my community. I got to use my degree and use my creativity to really make that position what I wanted it to be. So that's something to keep in mind, as we approach. I'm not sure if you folks are seniors or where you are in your path, but it's something to keep in mind that our degrees are so important to have, but we really can do so many things with them and make them suit us and our lifestyle.
Great. Uh, Thanks so much, Sarah. I think it's really underscores a really important point. I don't know if anybody else, either Sarah O or Tiffany, want to add to that, or anything that.
Yeah,
Go
I'd
ahead,
be.
Tiffany.
Oh, sorry. Okay. Yeah, the only thought that I had was I remember when I was a student, I found it incredibly intimidating to land on just one major. Um, and I knew I wanted to be somewhere in healthcare, but I couldn't figure it out quite because I knew it wasn't nursing. I think the clinical part of nursing I knew would not be a good fit for me, but somewhere in healthcare was where I wanted to be. I just hadn't figured out that it would end up being like a therapist type of healthcare. And I think probably the last few years is what really nailed that in for me. So like a little bit of luck was involved, I'd say, in figuring that out. And the other thing I'd say too is that when we talk about like the major that Sarah Shaw brought up the versatility of choosing a public health major and a college degree. And I would say if you're struggling with focusing too much on what the major means to you, try focusing on what the transferable skills are, because that is what will bring you to your next steps, is those transferable skills. And I feel like a lot of times it's not uncommon for you to, in a few years, you'll review your resume and be like, okay, well, I started off in health promotion. I jumped over here. And then I was like, for example, I worked in politics for a few years. And that's how I figured out I don't want to be in politics. So it's you find out yeses, you find nos, and it's a good journey to have, but it really burns down to transferable skills, I think.
Excellent point. Excellent point. I don't know, Sarah. I don't want to put you on the spot. Do you want to add anything to that? You don't have to, but.
Sure. I agree with Sarah and Tiffany, what Anna said as well. Like, public health is so interdisciplinary that after you graduate, like, the possibilities are pretty much endless. Um, just to answer the question about career path, so I attended a career and technical high school, and so that's kind of when I started trying to figure out what I wanted to do. And so the technical area that I chose was health careers, and it had more of a focus on clinical health, but I chose it because my mom was in healthcare at the time. And so I graduated high school with a nursing assistant. So I worked as a nursing assistant through college. And that's when I realized that I didn't want to do clinical health. I wanted to definitely focus on public health. Um, and so I studied health studies in undergrad. And then finally, after a 4-year gap, went back to school for my MPH. But that experience as a nursing assistant helped me to know what I didn't want to do. And so just like Tiffany was saying, you just have to keep trying different things to figure out what you like.
No, thanks so much, Sarah. That's a great. Not only is it a great point, it's a great segue into the next question as well. And thank you all four of you for your very meaningful and thoughtful experiences and sharing with. Really segues into the next question I have is because when you go over your career, not every day is going to be peaches and roses, but the I guess the question we want to ask now is what do you find, what aspects of your job, like you can describe kind of a typical day, but what aspects of your job do you find the most rewarding? Because you should, when you feel like you're going into work every day, if it feels like a drudgery, or something, or this horrible thing you have to do, it's going to be hard to keep up morale. But what do you find most rewarding, and what are some of the challenges that you face in your jobs? And that's a tough question, but
I can go first
yeah, thanks, Anna.
of course. So personally, what I find the most rewarding about this role is that, kind of how I was alluding to earlier, the work that my team does really helps drive the decision making around our healthcare benefit for our members. And so knowing that the work that we're doing is having a direct impact on them in a positive way, because all the work that we do is centered around providing affordable healthcare, and high quality healthcare to our members. Um, because our members are mostly, building workers, janitors, custodial staff. And so we want to make sure that we can extend all the money that they're putting into the benefit as much as possible. And so knowing that the data that I'm providing to different stakeholders, and just the information I'm giving them is kind of helping, to promote affordable healthcare for our members is the most rewarding thing. Um, and I would say like a typical day is in my current role as a manager, I'm talking to a lot of different stakeholders. So, we have an operational team, we have a policy team, we have a strategy team. So I'm talking to them a lot all day. And then the rest of the day, I'm really in our healthcare claims data, working with the other analysts on the team to kind of answer different questions that our stakeholders have provided to us, and really getting into the nitty gritty of it, which kind of segues into like the challenge, which is, our data. We're always learning about our data. There's always something to learn about. And, that's you when you think you've known everything, you haven't. And so there's always that room to learn as well, which I find challenging, but also rewarding because it's a role where you never get bored. We constantly are saying that. So, yeah, I would say that's kind of a good summary of my day-to-day rewards and challenges.
Awesome. Thanks, Anna. Thanks for sharing. Uh, Anyone else want to? Yeah, Sarah S.
I'll chime in. So I realize now in my introduction, I didn't really describe a good chunk of my role, which is the food pantry director. So I run a small food pantry down here in Westerly. So just the nature of my job is very rewarding. On a regular basis, I'm helping to provide one of our most basic needs to my community. That also is its biggest challenge, though, because it's a perpetual problem. I always say, in an ideal world, my job wouldn't exist, but it is. It's an unfortunate part of humanity is that there's always going to be need. One of my coworkers has a great little quote, and it's actually more typical to need help in this world than to not. So my team and I, my large team of volunteers and small staff, and I get to provide that every day for people. Again, we try to make a welcoming space because we know it's not someone's best day if they need our assistance. So that's, the highs and lows are very intertwined in a job like mine. And we're always just trying to focus on the light. It's actually it's just really nice. We have people that come in for the first time and it's very, very difficult. Nobody ever wants to ask for help. No one ever really sees themselves in a position to be in a food pantry. So it's our role to make it comfortable and just really normalize that situation. And again, just make people feel good about coming in versus feeling bad about coming in. And that's kind of the long and short of it. Otherwise, it's a little grocery store where it's free. So that's kind of the day to day is keeping the shelves full, keeping the folks that come in happy.
Thank you, Sarah. I don't know if anybody else, Sarah O or Tiffany, wants to talk about some of the challenges and rewards that they experience.
Yeah. Let's see. I think the most rewarding part of my job for me is probably being able to see like therapeutic impact in real time. Because a lot of the work that I do is in session, and I only meet with clients for, typically for an hour a week. And so it's it can be very refreshing sometimes and keep things interesting when you see them the following week and a chunk of the work that they do happens out of session. And so there's always something to talk about. There's always something to process. There's always something to sort of dissect and celebrate. Sometimes there's things to celebrate too when you reach these milestones and all this other good stuff. So I would say that's the most rewarding part. I think the most challenging part is, well, I think there's two answers to that, honestly. Case notes, which is a documentation, which is like probably the most boring part of my job, which is just documenting what happened in each session, because you need one for each session, and it's tedious work. And it's not my favorite part, but it's necessary. And the other challenging part, I think, is remembering that growth is not like a straight line, and processing is not always a straight line up. It looks like this, and there are dips, and there are, turns and twists and things. And so I have to work extra hard, I think, in putting intention behind remembering that. So those are the two challenges, I'd say, of my day to day.
Oh, that's a great point. And your career trajectory is a great example of that. So thank you for sharing. Um,
I don't mind sharing too.
Great, thank you.
No problem. So I think the most rewarding part of my job as a program evaluator on the drug overdose prevention team would be collaborating with my colleagues. So in the position that I'm in, a lot of the work that's done is very independent. Although when I do have the opportunity to collaborate with other people and brainstorm like innovative ways to look at data or innovative ways to improve interventions, I find that really rewarding. I think one challenge is not necessarily being able to see the impact that you're making every day. So you have to kind of trust that the work that you're doing has a positive outcome in the end goal in the long term, and just keep at it. Yeah, that's what I would share.
Thanks. That's also that's very good to know. And there's a lot of common themes there that we're getting. But so thank you for sharing that. Um, and we have a couple more questions before we open it up to everybody. But I think especially this crowd, I don't know everybody that's here, but I know it's a lot of HLT 300 students, a couple PHP 405 students, and a few other folks. So I think they'd be wanting to know what specific skills, experiences, certifications, other things that you feel would make our students, and our soon-to-be alumni more competitive for like positions like yours, either within your organization or sort of in your field kind of broadly.
I don't mind going first.
Oh, thanks, Sarah.
It's not a very competitive field. Shockingly, there's not a lot of people out for my job as a food pantry director. But the skills that I have that make me good at my job, I think are transferable across. And it's really just flexibility, and not necessarily meaning like you have to accommodate all the time, but just being able to approach each situation for what it is, I think is hugely important. And you have to be able to be able to take a step back, see what needs to be done immediately, what can be addressed, not so much like putting things off, but like what needs to be addressed right away to make sure that your day is functioning well, with your coworkers, with the people you're helping. A lot of us are in helping roles, so just being able to keep that bigger picture in mind on the day to day and not get buried by the day to day, I think is really important. Again, in my role, helping the community and working with volunteers as well. It's a lot of personalities on a given day.
That's a great point. I think it seems like a skill that kind of helps you. You might develop over time. You may not have it right away, but something that you get over time. That's great. Thank you for sharing that. Anybody else?
I can share some skills that would be helpful if you're interested in program evaluation or any type of research would be having some quantitative and or qualitative research like courses, like learning about focus groups and key informant interviews and surveys. Just like getting some experience with data collection and management, um, learning like a software. I know that and when I was an undergrad, there was a course I had to take for SAS. Well, that's like those types of softwares are really helpful. Like a qualitative one would be like Atlas TI if you're interested in qualitative data. Just like program management, I feel like is really transferable across the board. Um, so yeah.
Certainly a great. Those are very important skills. So thank you. Thanks for sharing that, Sarah. Anybody else?
Yeah, I mean, when I'm hiring for analysts, I definitely think having an MPH is definitely helpful. I think that also being able to have research experience. When I'm hiring for analysts, I'm really looking for people that have had experience with like large data sets, messy data sets, and just in general have like a very inquisitive mindset, and know how to like ask questions and aren't afraid to ask questions. Um, so, getting experiences either working with research with faculty or getting an internship where you can work with data, specifically if you're looking for a data analytics role. I think those are definitely things that can help you stand out and kind of help get your foot in the door in terms of an opportunity going forward.
Great points. Great points. Um, Tiffany, I don't want to put you on the spot, but if do you want to add anything to that, or you don't have to?
Yeah, I was still kind of thinking about it. Any specific certifications? There are different certifications out there for different styles of therapists. Like you have licensed clinical social workers who become therapists, or there's a completely different program offered, to my knowledge, at Rhode Island College. I don't know if it's offered anywhere else. It's also licensed mental health counselor. And there are different, like you can get into psychiatry and still be a therapist. So there are different pathways and different certifications to get to my position and do that kind of work. As far as skills, I would say probably the number one, the most consistent one throughout, regardless of whichever pathway you take, is probably you you might be best suited for the work if you're an empathetic person. Empathy is probably at the foundation of most of the kind of work and the kind of skills it takes to be like a good therapist and also be a happy therapist. And active listening, I would say. I'd say those two are like the bulk of as far as skills. There are several others, but the two that jump out to be the most are those.
But that's I feel like active listening is something that we could all, whether we're a therapist or whatever role, that's always a good thing a skill to acquire that's not as easy as it sounds. So that's good. No, that's great. Thank you for sharing that. I think all four. I think there's again a lot of recurring themes, but a lot of diversity there as far as skills. So not every there's not always the one size fits all job, and with the one size fits all skills. So that's great. So I do have a couple more questions, and then we'll open it up. Um, I would say so. The next question I was thinking of is your current role right now. What do you think where does this fit in general with your kind of career trajectory? Most of you graduated about, 8, 9, 10 years ago. So, like, do you see yourselves in this role long term? Are you thinking of, are there next steps that you want to take to kind of, to change things out, or things like that, or more schooling or anything like that. Um, so, and I don't know if anyone, this may not pertain to everybody, but anyone want to take take the first crack? I know this is a tough question.
Um, I guess what I would say is that in my current role, I definitely feel like I'm getting a lot of what I was looking for in general, which is really to be able to make an impact on population health. And I always kind of saw myself, what I enjoy the most is kind of being the middleman between people that are really deep in the data and like business leaders. And so I feel like this role has been a really good step in getting me a step closer to that because I'm definitely in the middle of like talking to the analysts or working with the data all the time. And then also, our CEO and the director of the fund as well. So I have very close relationships with them in this role, and I continue to learn in this role, and I feel like it's a really good fit for me and what I'm kind of looking for in my future career trajectory. Um, so yeah.
Thanks, Anna. I know all four of you, well, it sounds like we'll go far, but I know Anna, I know you very well. I know that you have wonderful things in front of you. So, um, anyone else it's a tough question. Anyone else?
I have a quick comment. It's one of those things for me. So I was an older student. I went back to college in my 30s. So I'm in my mid 40s now. So what's interesting for me in my career path is it seems like my job naturally changed every 3-ish to 3 years. So it feels like even though I've been with the same company, the same agency for the last 10 years, it really feels like my job has changed over the course of those years, which is nice. It keeps things interesting. So for right now, my career path is to stay with the Johnny Cake Center. We'll see what this next phase of really fleshing out the directorship role looks like. And who knows, maybe once I finish that, because again, this when I took the job on, I replaced a part-time employee and turned it from a part-time job into what is now a directorship. So I've been able to create these different positions, create these programs, and really better the services that we provide. So I guess I'm in that phase of like once I tidy up all these different pathways for other folks, I'll kind of see where I'm at and if I'm going to settle into that directorship role or if that's when I'm going to be ready to be like, okay, I've created this and I'm ready to move on. What that looks like, I'm really not sure. Honestly, you ladies have really inspired me. Maybe I'll hop on a plane.
That's wonderful. Thanks for sharing that. Um, that's no, that's I think it really raises the point that there's that that you can always change your things will change kind of naturally, and sometimes you can always there may be opportunities that you never thought you'd have, and so that's great. Thanks for sharing that, Sarah. I don't know. Again, I don't want to put Tiffany or Sarah on the spot, but if you have any thoughts about this that you'd
Sure,
like to share.
can share. I would say my current role fits in like my overall career trajectory because it aligns with my undergrad and graduate education. And like I mentioned before, public health is so interdisciplinary that I think any field and all fields can benefit from the education and the experience that a public health practitioner brings. Um, I've that 4 year gap between undergrad and um, like getting back into school for my master's. I did a lot of things. I worked in human services. I went to school for ministry. And also I have like a double major in English that I still really care about English and comparative literature and writing. So I'm still learning and growing every day. And so it's not exactly clear, but I just keep doing the same thing that I'm doing every day consistently until, you know, the next step. I'm ready for the next step. So yeah.
Awesome, awesome. Thanks. Yeah, well, we'll have to have this panel again in a couple years, and you'll tell us where you are at at that next step. So that's great. Thanks. Thanks. Again, Tiffany, I don't want to put you on the spot, but if you have any.
Yeah, well, I see. So my role has been sort of developing over the past year. I started a specific practice last summer, and it's been slowly growing and developing since. So I'm hoping that the trajectory stays that way and keeps on growing. I would love for one day to be able to be a part of, I don't know, have several practices where I can have the kind of impact on, like, where, so for now, my focus is with mostly with client impact, and that's always going to be important to me. But I do hope to one day be able to funnel some energy into helping therapists develop themselves. And I wonder if in a few years, if I'm ever invited back to the panel, I might be able to come back and say that there are several different group practices and that they are much more, I don't know, robust and impactful, and have more of a presence in Rhode Island, and are, preceded by the positive impact that they have on clients and therapists alike, and all that type of good stuff. Yeah. I hope that answers the question.
I think it does, and I'd love to have you back. I'm sure we can arrange that. So,
No pressure. No
yeah,
pressure.
it's love to see where that goes. So, that's great. Thank you so much. Thank you all. Thank you for your insights on that. And I have one more question I want to ask, and then I want to open it up to everybody. And this is this is kind of in the ilk of thinking about our students, our current students. Is there anything, and you can be as honest and raw as possible, is there anything that you wish you knew before graduating college, or any advice that you have for students that are looking to enter the workforce that you wish you knew, when you were in college, or you were you're about to graduate, or thinking about careers? And don't be afraid, please be as honest as you can.
Yeah, I mean, I would definitely say, and it's less about what I knew, it's just what I would encourage you all to do is, leverage your professors, leverage guest speakers in your class, reach out to them. If you find something interesting that they're talking about, reach out to them. I've two of the internships that I ended up getting. One of them actually, while I was at URI, was because I reached out to a guest that came in to speak at Professor Greery's class. And that's actually how I got an internship at the Department of Health that they kind of made because I was interested in the topic that they brought up. You never know how somebody can play a role in your career and in getting you opportunities. So I would definitely encourage you all to, if you hear someone talking about something interesting, or talking to your professors and you hear them talk about something interesting, talk to them, reach out to them, and definitely leverage that as a way of finding opportunities that you may not have seen otherwise, because sometimes people are willing to make opportunities for you. I think, Sarah even talked about how she's been making opportunities for herself in her current role. And so the worst thing that can happen is you can ask, you can reach out to somebody and they might not answer. That's definitely happened to me where I've reached out to people and they don't answer, and that's okay, but that's the worst that can happen. So I would always encourage you all to kind of reach out to people that are doing things that you're interested in and just talk to them and see what you can learn, and go from there.
Thanks, Anna. That's outstanding advice.
Really quick, that is fantastic advice, Anna. The other thing I would like to point out is, don't put off the scary classes. Don't put off the big classes to your last semester. I did that. I had a fear of the epidemiology class for 4.5 years. I started a half year non-matriculating before I really dug my feet in. I was fascinated by that class, and I think maybe my career would have taken a different turn if it wasn't my last semester of college, when I kind of already had a path forged. So again, don't be afraid to take those scary classes, and if you take them early on and you do poorly, you get a chance to take them again. Whereas thankfully, I did all right in that class. But again, you don't know what each day is going to bring. So again, don't be afraid to follow those leads. Don't be afraid to, like Anna said, ask the questions of the things that you find interesting. You have no idea what world that could open up for you.
Also, outstanding advice. Thanks, Sarah.
I can share really quickly. I'd say I really wish I understood like the importance of internship experiences in undergrad, because they really help you know what you're interested in and what you're not interested in. And they also count towards your work experience. So it's always nice to have like not have any gaps on your resume to like show like potential employers that you're working hard, you're actively engaged, you have goals that you want to meet. I waited a few years after graduating from URI to pursue my master's, which is totally fine. But I believe that part of that wait had to do with like the belief that I had that I wasn't ready to obtain my like degree, like to get my master's because I didn't have that experience. But yeah, getting work experience and saving money before your master's is great. But don't put off, pursuing opportunities because you're nervous or you doubt your capability. So you'll be amazed at how like the seemingly small steps kind of lead you along the way in your ultimate career path.
Well, excellent advice, Sale. Thanks so much, Sarah. That's great advice no matter where you go. That's great. Thank you. Tiffany, anything you, again, not to put you on the spot, but anything you might have to share about on that?
Yeah, totally. I would say, uh, hmm, I was thinking about like the strength of a good network. And so trying to keep in touch with whatever student network you have, if you've got one, before you graduate, I would say if I could go back, I would I might have put more energy or effort into keeping my network of other like-minded not like-minded other folks who were in the same kind of industry. So I would say never underestimate the power of like a good solid network. And if you feel like you don't have a solid network, my suggestion would be to try to build one, and put yourself out there, and resource. There are lots of great resources in Rhode Island for networking events and getting to know people and getting exposed to different kinds of training. I remember at one point when I was making my big career switch after flight attending, for a little bit there, I was not sure what I wanted to do. And so that's when I ended up spending some time working at for the office of the Lieutenant Governor. And that was a really eye-opening experience and great exposure to many connections in Rhode Island. You get to know a lot of people in a small amount of time, which is one of the beautiful things about politics, is it's really just all about like networking connections and keeping up with your connections. So I would say if you're passionate about that, maybe give politics a thought. And I think that about sums it up.
Thanks, Tiffany. That's great. Yeah, an interesting perspective too about thinking about getting involved with politics, especially now. Whatever side you're on, we need people to advocate for for public health and for the clinical work and everything and all that. So thanks for sharing. Great perspective. So with that, we have about 10 minutes left, and we would love, as Kristen said, we would love to have any questions that anybody else can would like to have answered by this incredible panel. So feel free to either put the questions in the chat or to unmute and ask questions.
I actually had a question.
Awesome, Aiden. Go for it.
I had a question for Sarah O. I was gonna ask, you mentioned having that double major in English and public health and like how meaningful the like comparative literature is to you. I was just wondering like what your original plans were with having the English major and like how that plan might have changed over time and just like maybe how beneficial you still think having that major is.
That's a great question. Thank you for that. I think so like my original plan, like when I was graduating from high school, I knew I didn't want to pursue like nursing. I had my nursing assistant license, but I didn't want to be a registered nurse. And my favorite class in high school was English. So I was like, you know what? Let me just study what I like and what I know. And so that was like my original plan. That was the major I declared at first. But then I had an opportunity in high school to do like a summer internship job with Lifespan, now Brown University Health. Um, so I was working as a nursing assistant over the summer when I was in high school, and it gave me some like good experience and helped me get, that job that I was working at while I was in college. But the director of that program told us about her career trajectory in public health. And she explained, public health is super interdisciplinary, and it has allowed me to do what I'm doing now. So she had done research on how providing employment opportunities for youth prevented like adverse outcomes. So she said that's why I do the work that I do. I was like, public health sounds interesting. And so after like halfway through my first semester, I said, let me double major in health studies. I think that having that English major has helped me to be a better writer, honestly. I feel like you can't you would always you benefit from, being able to write in any career. And I'm hoping in the future to do more writing, the type of writing that you do in public health. It can look like peer-reviewed journal articles, but I'm open to doing like a different type of writing in the future, though, for sure.
Gotcha. Thank you.
Welcome.
Thanks so much, Sarah. I just to amplify what Sarah said, and a great question from Aiden. Yes, writing is really key, especially and it's even in public health. Like, it's something that's a great skill to have. That's no matter where you are. So thank you. Looks like we have a question in the chat from Sarah. From Sarah, an HLT 300 for Tiffany. I don't know. Yeah. I don't know if you can see that, Tiffany. Oh, so it's how was your experience as a flight attendant, and how did it contribute to your career journey and personal growth?
Ooh, that's a great question. So the way it contributed to my personal growth is traveling on my own and spending so much time sort of working independently and taking up space truly just on my own, really made it easy for me to get to know exactly who I am when I'm the only one in the hotel room, to put it plainly. I think when I started the job and I first graduated, I was quite like I knew some things about myself, but I don't think I quite knew everything I wanted to know about myself. And I think getting the chance to do exploring in a sense, and just taking myself out of my comfort zone, first of all by applying, and then by just getting on the plane and just going, and not looking back, was probably one of the best decisions I've ever made, because it's contributed to an incredible sense of self. And I got to know myself very deeply through that job. And it gave me a chance to get to know, to really just highlight some of the skills that I didn't know I had. Like, I used to be just terrible with directions. I've just always had a terrible sense of direction. I mean, I get lost in Roger Williams Park all the time. And so to be able to go from that to understanding like the train system in Chicago, and navigating all these different airports all across the state, and not being afraid to just walk out in a city that I've never been to just alone and feel sensibly safe, is just a strength that and a skill that I did not know I needed. When I finished flight attending, the confidence that I had from spending so much time doing that and getting so used to doing that stayed with me, and it made me just easily I don't know, I think it just made me more brave in public. And so I had a much easier time like reaching out to, for example, when I finished flight attending and I was sort of in that in-between space that I mentioned before, right before I got into politics, I had no idea who the lieutenant governor was. I just knew her name, and I just happened to meet someone who had her phone number. And so I was talking to somebody, and I was explaining to them about, like, here's where I'm at in my career, and here's where I'm trying to get to go. And I'd really love to connect with this person. If I were able to be mentored by anybody in this world, it would be her. And if there's an opportunity for me to connect with her, what do you think? And so anyway, just by luck, they were like, you know what, I think you should talk to this person. And it ended up being the lieutenant governor herself. So I said, okay, sure, I'll reach out, call her up. And then what was supposed to be like a 5-minute phone call ended up being like a 15 to 20-minute one about everything she's into right now, everything I'm into right now. And so just that one phone call and the bravery that was behind it, a few months later, I was like in the shampoo aisle at Target, and then I get a phone call, and it's the office of lieutenant governor, and she's like, "Hey, I want to know if you want to work for me." And sometimes things work out that way. Sometimes there is luck in this world that will put you in the right place at the right time. You just got to be less afraid to do it and make those kinds of things happen. So you got to be open to it all, is what I would say. Does that answer the question?
I I think so. That's incredible. No, that's incredible. Thank you for sharing that. So, yeah, that's yeah. I mean, I think it's like like going out of your comfort zone and being open to these things that you wouldn't necessarily have thought of. That's wonderful. And also a good thing to go to the shampoo aisle at Target, because you never know what kind of phone call you might get. Um, so in the last, thanks so much, Tiffany. In the last couple minutes, I think we can kind of combine these two questions. Like they're pretty similar. So Gwen from PHP 405 asked to everyone, do you think you need further education besides your bachelor's to land job opportunities after college? And then Jazz, also from PHP 405, said, for Anna, I'm interested in epi, but not sure if I'm ready to pursue a master's, and what kind of jobs opportunities should I look to see if I really enjoy it. I'm trying to turn off Jasmine from epi, but apparently I'm failing. I don't know if anyone, we only have about a minute or two left, but if anyone wants to take that, or maybe Anna or anyone, that'd be great.
Yeah, I can kind of speak to that a little bit. Um, so if you're not sure about epi, I would definitely say talk to people that have an MPH in epidemiology, have a deeper conversation. They can kind of give you a better idea of like what kind of things you can expect in that kind of an environment. I would also say if that's something that you're interested in terms of jobs, looking for research assistant opportunities. A lot of hospitals are doing epidemiological research or just research in general. A lot of universities are also doing that kind of work as well. So I know, for example, a lot of the major hospitals in New York City are doing that. NYU has opportunities like that. Columbia has opportunities like that. So I think that those are good opportunities or internships if you're able to get them with professors doing that kind of research. I think that that's a really good way to kind of get a taste for working with data. But like I said, also another way is just to kind of talk to people that have the degree, that either are in the university or have professors connect you with alumni that have the degree. And then I think, like I said, they can kind of give you a better idea. I also believe you can probably get a certificate in epidemiology from a university that's like a much lower level of commitment, which can kind of expose you to a little bit more of like the kind of work that you would be doing as an epidemiologist, and then go from there as well. So that would be my advice for that.
Fantastic perspective. No, thank you. Anyone else want to add to that? Again, no, I don't put anybody on the spot, but
I can add
yeah, thank you.
to the first question about whether or not you need, like, if you're able to get job opportunities right after graduating. I think you certainly can, especially if you take time and you do internships in undergrad, and even after you graduate. Like Anna just said, you can do like a graduate certificate. You don't necessarily have to jump right into your MPH. You can take time, figure out what you want to concentrate in, save money. Um, for example, my brother, he went to URI too. We graduated the same year, and he majored in communications with a minor in like African studies, and then he got his PMP, his project management, and then now he's working in public health. So it there's many different pathways. But yeah, I think that there's so many different graduate certificates you can get before, going back to school for your master's that can be considered.
One other thing I will say is some job opportunities do provide financial assistance for you to get your master's. And so that's something that when you're applying for jobs or you get a job offer, definitely something worth asking because a lot of programs are also part-time. So for example, like my program at NYU, I did it full-time, but there was a lot of people that were doing it part-time, and the schedule of the classes was actually centered around people that were working full-time. So a lot of my classes wouldn't start until like 4 or 5 o'clock, sometimes even 6 o'clock. So it made it really flexible for people to work and also get their master's at the same time. So definitely something to ask about when you're interviewing or getting an offer.
That's a
Just one
great
more
point,
quick,
especially
sorry,
where master's degrees are very expensive. I'm sorry. Sorry, I didn't mean to interrupt
just a
there.
quick thing to add. You reminded me, Anna. So just a plug for working for Department of Health. Um, we have a tuition reimbursement program. So if you are working for Department of Health and you want to get your master's or your PhD, let's say you start working when you have a master's, um, they can pay for part of or most of your degree. So just a plug.
Well, thanks. No, that's great. Thank you for it. And I'll actually take this opportunity to say we are starting a master's program and a PhD program in the fall. So that just came out a few months ago. So um, unfortunately, sadly, we are out of time. It's we're a couple minutes past. I apologize that we went a little long. But I want to just take a moment to thank, through my immense thanks to the panelists, Anna, the two Sarahs, Tiffany, for your amazing insights. Thank you so much for taking the time out of your busy schedules to do this. I also want to thank Kristen for organizing this and all of the other ones for all of the other majors. Really, really, she's a fantastic resource for all of our students. The office, the Center for Career and Experiential Education is an amazing resource. And thanks to all the students and other folks and guests who joined today. And I don't know, Kristen, do you have anything you want to add or mention or anything?
That was a great ending. Thank you. Yes, thank you to the four of you. I really appreciated your authenticity and honesty as you shared your paths, and wanted to touch on that sense of bravery with Tiffany kind of full circle. I mean, it takes a sense of bravery to open up your own practice. So I think that might have snuck in there as well, after kind of that self awareness journey that you took. And then that was kind of a mimicked throughout the four of yours kind of journey. I mean, Sarah Shaw, you made your position what it is now from something that was a little bit different. So I know Sarah for a number of years, so kind of wanted to shut that out as well. All right, with that, I think we're at time. Thank you all for being here. Appreciate the four of you. Steve, as always, willing to moderate the students being here. With that, I'm going to stop our recording, but you're able to view it on the Career Center's YouTube page. I'll make sure all the students get that link as well. Thank you again. We all appreciate it.